Thank you very much, Rory, for joining us to talk about your role in the Dentist Health Support Trust. Yeah, thanks very much for coming in. Could I begin by asking you to describe your roles in relation to dentists' well-being?
Yes, one has to emphasise the roles.
Yes.
Because there is more than one.
Yeah.
One primary role is clinical lead for the Dentist Health Support Trust. And the Dental Health Support Trust is a charity run by dentists for dentists with mental health and addictive disorders, but we also cover other areas of well-being, like degenerative disorders, which might impact a person's fitness to practice. And then the other role I've got is I'm a clinical lead at the Practitioner Health Programme, which is an NHS-funded service for doctors and dentists. Currently that's pan-London, with a national service for general practitioners, but later this year it will be rolled out in England as a service for all doctors and dentists. And that I think will make an immense change to how dentists will be looked after going forward nationally. It's important to note that it includes dental students, dental in training also.
And can I check on that? Does it include hygiene therapies?
At the moment,
and nurses and that sort of thing. So.
At the moment, the answer is no, but it's also yes, in that if we get referrals, we will look after them.
Yeah.
In part of the role, in terms of an extended role, would be if there are major difficulties in a practice, or even in a dental school, if something significant occurred to a colleague, like, say, death by suicide, which does happen, or a significant accident, like a road traffic accident, that could affect a whole practice or a department, then one of the things the Trust offers is that I will go into the practice and see all members of staff individually who want to be seen, and then run a group if necessary, and then repeat that maybe 3 months, 6 months later. But so with regard to the hygienists, etc., we won't refuse them. The Trust is speaking, and at least attempting to speak to leads in those other registered bodies to look at how we could possibly extend it. Of course, if it does extend, then the staffing of the Trust, etc., will have to extend. But we're not taking them at the moment.
Yeah.
So there's a small number on the caseload.
Okay, great. And I think we'll come back a little bit more to the Dentist Health Support Trust and Practitioner Health Programme, which you mentioned as well. So could you describe some of the ways in which dentists present when their well-being isn't that great? I mean, how do dentists manifest when things aren't going so well?
I suppose you break it down into two ways. You could look at it from the perspective of mental health, and then you look at it from the perspective of addictive disorders. The mental health, of course, there's a breadth to it. It may well be stress, anxiety, low mood, depression, over-checking, a bit of obsessive compulsive nature to things. Sometimes food as an issue. And I think it is interesting the numbers who come, where it does feel like that the primary trigger is the role they have themselves. There are obviously some people who present with some genetic and familial loading in that there is a history within the family, but it is a significant number present with work as being the primary issue. So stress, anxiety, depression, I suppose occasional bipolar disorder, and then substance use, misuse, dependence, different levels, different degrees. Triggers, the job itself, maybe perfectionism. I think there are groups within the profession that perhaps trigger as much as anything else. So GDC seems to have an impact on people, which is quite fear-based. CQC is another. NHS England is another. Now, I suppose my view of them is that every profession needs a structure. If you're going to be registered, there's a legalistic component to it, like the responsibility that people are fit to practice. And a lot of my work around that, including with students, is to, if you like, walk with these organisations rather than rail against them. There are some very positive things about them, and I think if you work on the principle of sort of do not be afraid, it could be quite helpful. But fear seems to be the driving force of a lot of things for individuals as dentists.
Interesting. Okay. So, I don't know if you sort of hinted at something there, but are there things then that dentists can do to help improve and maintain their well-being? One of them seems to be not to be too afraid of some of these bodies would be one way of starting.
Absolutely. I think it's to be defined by more than the fact that you're a dentist. Then in a sense, dentist, it's a part of you, but it's not the whole of you. Having a registration as a health professional doesn't make you immune from life's challenges, and whatever they may be in terms of relationships, financial concerns, families. And so not to solely define yourself as a dentist, to see it in a sense of, from a well-being perspective, that you could argue there is a mind, there is a body, and for some people there is, in a sense, a spirit, so to speak. And it's being able to acknowledge the presence of those, and then what responsibility you have as an individual for taking care of that. And what I often say to dental students as they say, for example, transition from training into first year VT and then on to the career is to remember that they are more than a dentist, and that the support that they may have within the dental school, like friendships and groups that they may belong to continue that belonging when they go out into the profession, whether that's in the east of England or the north of England or central London. It doesn't matter. Get a sense of belonging, belong to something. If there are things you enjoy doing, such as exercise, join a club, belong somewhere. If you want to play music, find a place to play music, even if it's on your own. So keep that sort of creative, nurturing bit alive. Look at what you eat. That's, to me, that's quite important. And I think also, with regard to the substance use, remember that in that sense you're more than a person. You're also a person who's registered to practice, and whether we like it or not, the GDC and your employers will look at recreational use of substances in a different light than you might expect if you were in another job that is not registered. So you have that sense of responsibility is really important. So to me it's look after your body, look after mind, look after spirit. So do mindful things, do some relaxation, do some exercise. If you like reading, read. Create friendships, because it's maybe the single most important thing in the whole of mental health and well-being anyway, is often with these conditions as they develop you get into this journey of perseverance into isolation, as I describe it. So loneliness can be a trigger. Now it doesn't mean you have to surround yourself and be constantly on the go, but just to know you're doing more than going into the practice, doing a job, finishing, going home, getting up and starting again. And things like 20 minutes of exercise in a day, 10 minutes of relaxation, being mindful about what you eat can make a huge difference.
I know. So I guess a lot of, particularly once people get out of hospital-based work and into practices, it can be quite easy to end up feeling quite isolated physically and so on. But I suppose even within hospital work, you can still feel lonely and so on as well if you're not making space.
I mean, the hospital may have the structure, but if you don't become part of it, then the isolation is easy. And as I say, when it comes to things like exercise, that idea of coming home from work, going straight out, doing 20 minutes, half an hour, you know, if you go to the gym, it doesn't have to be a 2-hour session, just that little bit, and then when you have time, obviously do more.
Yeah. Okay, great. So coming back to the Dentists Health Support Trust then, and other organisations, how might they help dentists who are struggling with their well-being?
Yeah, and how it works, if we begin with the Dentist Health Support Trust, is there is a telephone helpline, which is still probably the primary way that people make contact. Interestingly with that, the highest number of calls I get is from the dentists themselves in difficulty, whilst practices, you know, practice managers, partners, owners, colleagues, family, police, GDC, indemnity organisations, dental schools, etc., will make contact on behalf of the dentist. The first connect really is either via the phone or the email contact, which is available on the website. And then really from there it builds, and the building is what's going on with that individual. I think the first call is often an interventive type call. What's happening? What's going on? Again, if it's email exchange, it's the same thing. Find out a bit more about what's happening. And then, you know, if it looks like there is a condition, even if it's not diagnosable, you know, in a defined sense, but they're sufficient to suggest that somebody is stressed or anxious or low in mood or drinking too much or whatever, is then to begin a process of assessment. And all of the time, to me, it's about building that relationship with the individual, because I think that sort of trusting therapeutic relationship is often the foundation that gives them the freedom to actually then accept more support going forward. And then if there's a need for intervention in terms of treatment, then my role as lead clinician is to identify what might be the most effective treatment for that individual. And sometimes it is little more than space to talk, and I can provide that. Sometimes there may be a more specialist intervention required, so we would look at, let's say, for anxiety, low mood, I would always tend to look at talking therapy first, something like cognitive behaviour therapy, maybe a more dynamic psychotherapy, and then sometimes alongside that, or a bit further down the line, if improvement isn't being noticed, then consider medication. And I think one of the values of the change with regard to the practitioner health programme, for example, is that one of the difficulties I've had over the years is accessibility to services for dentists. Because see, one of the blocks in the system can be, if you're a dentist in difficulty and you're in an area where your general practitioner, who's often the gateway into services, is your patient. It's not easy to go to the GP having, you know, done whatever you've done in his mouth last week, to go and sit down and say, you know, I'm low in mood, I'm feeling suicidal, can you help? Or I'm drinking a bottle of whatever a day. You know, that it can be quite difficult. So I think one of the values of the new services as they develop is specialist physicians with training, then that's your access point. But you know, but in terms of the role, it is doing the assessment, having the treatment, and then around that is the idea of support, and maybe supporting them back into work, supporting with if there are GDC concerns, NHS England concerns, how we manage those, talking to family members. On the addiction side of things, there is a national support group that meets monthly in pretty well every city and major town in the UK, and that's really a mutual support group run by the doctors and dentists in difficulty. What I'm looking to do is to develop a similar type of support network for doctors and dentists with mental health issues. It's not something that's been widely tackled, but it's on my agenda at the moment, and we'll get there with it. I already mentioned the idea that if a practice is in difficulty because of a major event around ill health, then one of the things we'll do is offer to go into the practice. We don't end up as knights in shining armour coming in and taking over, but make the offer, and then we'll see whoever needs to be seen, and then follow that up. And you know, I think one of the things that we've done over the years is mirror the work we do around the time it may take to get through a GDC case, for example, which with undertakings and condition might take a couple of 3 years. So a lot of people who are known to the service will remain known to the service for, say, a couple of years at least. Part of the support is regular email contact with individuals, just asking them how you're doing. And there's a remarkable return on that within about 72 hours. People seem to be just pleased to be asked. And then it allows me to do the follow-up as necessary.
Regular checking in.
Yeah, regular checking in.
Okay, great. And you've sort of mentioned the General Dental Council there. The Trust has taken on sort of new role in that capacity. Could you just talk about that?
Yeah, the history of that really came out of the Practitioner Health Programme, when I was involved in the setting up of that as a service. One of the roadblocks to it was getting a memorandum of understanding with the GDC and the GMC that would allow the service to see doctors and dentists in difficulty without reference to the GMC, that we had a judgment called in terms of the individual's health with regard to fitness to practice, that there were some people we could ask just not to practice for a period of time, get well and go back to work, or continue to work with our support, and the GMC, GDC didn't need to know about that. And in recent times, we adapted that in the Dental Health Support Trust, but in recent times with our chairman, we have spent quite some time discussing our memorandum of understanding with them, and we've now extended that to one increased referral from the GDC to the programme, and that's partly by a separate letter that goes out in the bundle encouraging everybody to make contact with the Dental Health Support Trust for support, regardless of whether there's a health issue or not. But I think the really important bit now is that when a dentist gets referred to the GDC, we are in a position, particularly if it's a health matter, whether it's a purely health matter or it's a health matter alongside a performance issue or a fitness to practice issue, they, within a matter of weeks, they make contact with us. I see the individual, we do an assessment, and then we inform what the undertakings or conditions can be. So now this is happening within 2 to 3 weeks. And what it means is that the dentist concerned is no longer having to wait maybe for months. Because I think currently it's something like 280 plus days before the matter gets resolved to a point of the person has undertakings conditions. Now they may be suspended throughout this time, but what we've now done is, particularly from the health side of things, is manage that within 2 weeks. So the dentist knows, I need a supervisor in the practice. I will have a supervising psychiatrist. They will be met, within a month or so. And if they can continue to work, then they just continue working. So it's transformed the whole thing. It's obviously in its early days. We will work together. We need to work with the indemnity organisations also. And there is more work to be done, but at the moment it's going really well.
Well, it just takes away that massive cloud that hangs over anybody who's been through any sort of GDC process where you've just got no idea what the outcome is for months or years.
Yeah, and from my perspective, that part of it is, I talk quite a bit about, in a sense, do not be afraid. So it reduces that time of fear, and the fear is uncertainty of what's going to happen. And of course, you know, we're not prophets, we can't determine completely what's going to happen, but now at least we can say, right, from this aspect, this is what's going to happen, it's going to happen now. You can now continue working with support from us, and provided you comply, there is less to fear. And then obviously we support people through the extended process if need be.
Great, well thank you very much. I mean, as we've just been talking, I've just reminded of something that I come across fairly regularly with qualified dentists, is this fear of going to the doctor and saying, you know, I'm not well, or I'm taking drugs, or I'm using alcohol, or whatever it is, and the fear that automatically then gets marked against them in some way. But I think what you're suggesting is that through the various ways, although that may be necessary at some point if it's affecting their performance and so on, when they first initially making contact, they should feel confident that with the practitioner health program or the Dentist Health Support Trust, that actually it's not inevitable that
it's not inevitable, and
be reported in some way.
Because what the GDC will say was, look, if you're with the practitioner health program, if you are doing this, and all of these safeguards are in place, so that the public are protected, and really the profession is protected also, as well as the individual, then there isn't a need for us to be involved. You know, that's, and I think it's continue to progress that. We have a responsibility, and you know, if there are things that need to be shared with them, of course we will.
Yes.
And I think the dentist's concerns, you know, from the outset know that participating in what we're suggesting is vital, because failure to do so means you will be asked to self-refer. You know, there's no doubt about that.
Oh, thank you very much for finishing on that note and positive note, and thanks very much for coming and talking about.
Delighted. Thank you.